going to introduce you to a medication that the Food and Drug Administration has been working on. We're going to be talking with Dr. William Jamack, who is with the CRC Health Group, and he's located in Pennsylvania. We're going to be talking about this stuff that has to do with substance abuse. And first of all, Dr. Jamack, this material called Vivitrol, tell us a little bit about it and a little bit about why it was developed in the first place.
Sure. Vivitrol has actually been around since 2006, and it was initially approved to treat alcohol dependence and prevent urges and cravings that alcoholics experience. The Food and Drug Administration approved it in October of this year to prevent or assist in the prevention of relapse for opiate-dependent people. And basically, what this medication is, it's an injectable medication that you get once a month, and it works in the reward or pleasure centers in the brain to reduce the urges and cravings to use drugs, particularly opioid drugs and alcohol. And obviously, this is a huge problem, Bill, huge. Throughout the country, we're talking about 16 million are addicted to opiate drugs, and if you include alcoholics, about 30 million people are addicted to drugs and alcohol. So a huge national crisis and problem for Americans, and we need to get people into treatment and get them help.
Could you explain to us how Vivitrol works? How does it work to help a person get off of these problem drugs?
Absolutely. Again, we've been using Vivitrol at CRC Health Group for approximately 4 or 5 years now, since it was approved for alcohol dependence, and we've begun using it for opioid dependence. What it does is you get an injection once a month after you achieve abstinence typically in an inpatient drug and alcohol treatment facility. Then you get the injection, and this helps reduce the urges or cravings to pick up and relapse into substance use. It reduces the urges and cravings through the reward centers in the brain. This differs from other medication-assisted treatments in that it is a non-addictive drug. It's basically not a narcotic. Many of the medication-assisted treatments for opioid dependence, such as methadone and Suboxone, are addictive medications. This is not, and that's what separates it from the others. It allows addicts to achieve abstinence.
Can you get started with this in a residential rehab setting and then move to the home? Does that work quite well that way?
Typically what we do at CRC Health is we will provide the first injection during an inpatient treatment situation at one of our residential treatment facilities, and then after that we would assist addicted individuals in finding a provider in the community who would follow up with maintenance treatment, monthly injections of the medication. This does not work in a vacuum. Addicted individuals continue to require counseling, therapy, support groups, things of that nature. And if you or a loved one does need help, you can certainly seek help through our website, which is called seekhelpnow.com, or call us on our phone at 866-575-8186. CRC Health Group is the largest provider of drug and alcohol treatment services in the country, and we would certainly be happy to try to help those in need.
Why aren't there additional drugs out there to help with this sort of addiction, to treat this addiction? This seems like there's a lot of need out there.
There certainly is, and this is a major breakthrough, and we're really happy and excited to bring it to individuals who have this problem. There is a great need, a huge problem in the country. It's almost at epidemic proportions. And we're not just talking about heroin. We're talking about pain medications that may be utilized by doctors for legitimate reasons, and then people become dependent on them, addicted to them, and the next thing you know, start engaging in addictive behaviors. So, huge problem, and you're absolutely right. There is a need for treatment. there's a huge treatment gap as well. We're talking about as many as 20 million Americans may need treatment that do not get treatment on a regular basis or an annual basis.
How can we see that young people will not get into this addiction cycle that will cause problems in their lives?
Well, I think prevention starts very early in life, Bill. We're talking about getting to know your child, sitting there and talking with them at the dinner table about these things, knowing who they're associating with, what they're doing, where they're at, and having a good relationship with them and an understanding of their needs and wants so that they don't turn to a negative peer group and they don't get involved in these. Obviously, it's not just a childhood or adolescent thing. Many adults may go through life, have had very healthy childhoods, and then turn to addictive drugs. So I think educating adults, educating physicians, developing the sense that you can rely on things other than addictive medications for pain treatment. There's a variety of things that can be done. And I think people need to be educated about the consequences and risks as well and what this can do to destroy your life.
We're talking with Dr. William Jamack, who is with the CRC Health Group. We're talking about a material called, actually it's a drug called Vivitrol, which is a breakthrough, a tremendous breakthrough when it comes to substance abuse in this country. And Dr. Jamack, how can a person find out more information about this? And like we said, the FDA has just approved this, haven't they?
Yes, they have. October of this year was just approved for opioid dependence. And again, I'll restate our website, which is seekhelpnow.com, or our phone number, which is 866-575-8186. The company that makes Vivitrol is a company known as Alkermes, and they probably have a variety of ways in which you can get in touch with them and or obtain information about the medication.
But the idea is to get help. If you got a problem, or if you have a family member or a friend or something like that, get help. There is help out there, isn't there?
Absolutely. Call us or look on our website and seek out a provider in your area. We're throughout the country. We have a lot of treatment opportunities for patients who are addicted.
Dr. William Jamack has been our guest here on our program, and again, the name of the item is called Vivitrol, and I'm Bill Peterson reporting.